So the current treatment methods right now in America, it's dictated by the insurance companies, and what they're going to have, you can either have a prostatectomy, which is total removal of the prostate with surgery, or you can have radiation. The problem with prostatectomy, it has a high toxicity rate of incontinence and sexual dysfunction. After 12 years of doing this, it is very unusual for me to run into a man who's had a prostatectomy that tells me his sexual function is just fine. And none of them have a natural sexual function. They all have to use either Viagra or Cialis. And the incontinence rate is also pretty high. I mean, many men, they may not be wearing diapers, but they have to wear pads. And so these are the two big complications following prostatectomy, is avoiding impotence and avoiding incontinence. Radiation therapy also has a high recurrence rate of about 30%. And radiation, even though there are now 5 different kinds of radiation, and the latest radiation, which is the new kid on the block, the proton therapy, does have less, the literature is bearing out that it has less toxicity than the traditional radiations. There's still a problem with toxicity. I mean, you can still burn the rectum, you can still burn the bladder, and of course that depends on where you're going to get your treatments. Of course, radiation also requires usually that the patient has at least 30 to 60 days of hormone deprivation, which means taking your testosterone levels down to 0. And patients don't like this. And some cancers, the guidelines require the patients have to be castrated for up to 2 years with chemicals. So that's not necessarily a pleasant side effect. And on top of that, you may require either the rectal balloon for all 6 to 8 weeks of treatment, or better yet, a better treatment would be to put in the rectal spacer, the gel between the rectum and the prostate. So all these things require lots of side effects. All these things have more toxicity.